finishing up a prescription. My apologies. Yes, just pop yourself on that seat there. I will be right with you. Okay. Hi. How are you? Good. So, overall, good. And the reason for your visit today? Yes. Let me see. Say they told reception you've been having headaches, insomnia, and a couple of concerns about your cognitive function. Okay. Seems like you've done the right thing by coming in today. I think we'll do a cranial nerve exam. This is an overall assessment. It's a general medical checkup, but it also focuses on your cognitive functionality, making sure that basic things, like your vision, sense of smell, muscles, all of those are working correctly and as they should be. It's a good sort of overall way of catching anything early or spotting any red flags that we might want to catch and explore more deeply. Good. I mean, it sounds complicated, cranial nerve, but it's a very simple test. There's no right or wrong answers, of course. Hopefully we should be able to get to the bottom of whatever it is that ails you. Okay? And to be fair, when it comes to things like headaches and some lacking cognitive functions that are usually there, it more often than not boils down to lack of sleep or stress. Stress is such a big causation and factor in so many cases that we treat. Obviously, not everybody has the means to mitigate stress, but we'll give you some advice and, if necessary, some medication to recenter yourself and focus. But first off, we're going to take your temperature. Just going to check your vitals. Alright. Change these gloves. Fresh pen. Okay. I just have a thermometer here. This is just a little device that's going to go under your tongue and tell me what temperature you are. Okay? If you could just open your mouth like this. Lift up your tongue. And I'm just going to pop this here. Try to just relax and breathe normally. Okay, yes. Absolutely fine. 36.4, which is bang on perfect. Just going to check your heart rate now. I'm going to do it by feeling under your neck for a pulse, okay? Actually, this is the old-fashioned way, but the old-fashioned ways are the best. So, just going to place my hand here. Ready? Try to just breathe and relax. If you're slightly stressed, it can give a false reading or an elevated heart rate. And very good. 2, 3. Yeah, that's fantastic. resting heart rate of 68. Just going to double check that one on your wrists. Okay, just this area here. Any preference on wrist? Okay. Ready? Just going to hold this here and again. Okay, that one's about 70. So between 68 and 70 is very healthy. Yeah. Let's listen to your breathing. Can't see on your chart that you have any lung or breathing issues. No. Have you had COVID-19 within the past 6 months? You haven't had it at all. Okay, that's good. Right, sometimes it can affect the breathing. All right, so I'm going to try and do this as invasively as I can. It's just going to go down this bit of your top, okay? So if you could just undo the top button there. All right, try and warm this up. And just popping this here. Okay, if you could just 3 seconds on the inhale, hold it for 1 to 2 seconds, and then 3 to 4 seconds on the exhale. 1, 2. Very good. Over here. And hold it. Exhale, very good. And let's go down here. Same again. Okay, that sounds clear. Let's just come around the back side now. Alright, okay, so same again, big deep breath in, and then hold it, and then exhale. Okay, this next time I'd like you to just give a little cough once you've inhaled, so, and now just a little, like you're clearing your throat. Okay. Down here, same again, and then one more time. Okay. Breathing sounds good. No obstructions, which is fantastic. Pop this in here. Okay. Alright, let's move on to the cranial nerve exam portion. So we're going to start with your olfactory nerve. This is your sense of smell, okay? Now I've got some scented bottles here on the side. And these are all normal, easy to guess household smells, if you will. Just gonna ask you to cover one nose, inhale, and then let me know what this scent is, okay? Have an average sense of smell? You haven't had any injuries or infections that have affected your sense of smell or taste? No, okay. Oh, you're lucky. Some patients can't smell or taste anything. It's very sad. Okay, first bottle. I don't think it says what it is, but try to avoid looking at the bottle if you can. I'm sure some of them have the scents marked on them. Ready? Big deep breath in and your best guess as to the smell. Rather easy one, that is orange. One of my favourite fruits. Okie doke. Okay. Big deep breath in again. This one's a little harder. Well guessed, that is chamomile. A soothing fragrance. This is the third bottle. Okay. Let's switch sides to our other nostril if we could. Alrighty, ready? Okay, here we go. Yes, easy. Mint or peppermint. Last one. Deep breath and your best guess. Of course, that is strawberry. Beautiful citrusy smells. Olfactory nerve seems absolutely fine. Good, good, good. Tick, 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 tick. Alright, let's check your visual fields. Alright, so I've got a small paddle here. You can use this to cover one of your eyes. Then I'm going to ask you to stare directly sort of the center of my face, okay? It doesn't really matter where, as long as you're not looking at my hand, which is going to be in your peripheral vision. Now, I'd just like you to tell me when you see my fingers wiggle, okay? So, start by covering this eye. Just looking here. Just let me know when you see my finger wiggle. Good. 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 No peeking. Good. Alright, let's switch sides. So, it's covering this eye. Let me know when you see my finger wiggle. Good, fantastic. Very good. Okay, let's check the visual acuity. For this, I need the Snellen chart. This is a small handheld version of the one on the wall over there. Okay, so I'm going to cover one of your eyes again and then instruct you to read the lines. And we're going to get progressively harder, okay? So we'll start here. And just again, covering this eye, read the top line. Good, and the one beneath. Yep, and the one beneath that. Very good, moving to the one beneath that. And can we try the one beneath? Struggling a little bit now, okay, well. Just one last try of the one beneath that. Okay. Yeah. Reasonable. Doing the same on the other side now. We're going to cover this eye. Can you see the chart? Okay, let's start on the top line. Moving to the line beneath. Yep, and the next line. And the one beneath that. And the one beneath that. And finally, the one beneath that. Okay, using both eyes, I'm going to point to random letters and I want you to tell me or give your best guess as to what they are, okay? Ready? Yep. Yep. Yes. Okay. Okay. And here. And here. And this one. Okay. A valiant effort. So here you wear glasses, so particularly well done for doing that without. Alright, so okay. Let's do your ocular motility. Okay. Alright, just looking here. Keeping your head still and covering this eye. Can you see the light? Alright, again, head still and just tracking with your eye wherever the light goes, okay? So good. We always start by using a H pattern to check through the different quadrants of your vision, and then move to the diagonal in an X motion. Good. Alright, now cover the opposite eye. Looking here. Can you see the light? Alright, now without moving your head, following the light wherever it goes. Fantastic, you're doing very, very well. Okay, good. Ocular motility seems to be perfect. Alright, so ocular motility. Alright, let's have a look in the back of your eyes now. My apologies, I'm going to need to come rather close to you, but it's all in the interest of finding out the back of your eyes are working as they should be, okay? So if you could just pick a spot either behind me or staring at my ear. Okay, if you could look straight ahead, directing your gaze upwards, look to the left, and look to the right. Look down. And back to the center. Okay, if you could look up and left. If you could look up and right. Down and left. Down and right. Okay. Let's move over to this side. So. Finding the vein, following the vein down, and looking straight ahead. Looking up, down, to the left, to the right, back to me, up and left. Up and right, down and left, down and right, back to the center. Okay, good. Just gonna write that down. Everything is good. This is a pupillary light reflex. Alright, if you could focus on an item behind me, either the jellyfish lamp or the skull or the model of the foot skeleton. So, take your pick. Okay, just staring at that spot. I'm going to check the direct response of your eyes to light. Direct response. Yes, both eyes seem to be responding. Okay, and the consensual response looks perfect. Okay, good. Covering this side. If you could just look at the wall chart. Okay. Direct response looks to be accurate. And the consensual response looks good too. Alright. I'd like you to focus on the paddle, and when I say switch your focus to the light. Okay? So, paddle, light, paddle, light, paddle, light, light, paddle. Very good. Paddle, light. Keep looking at the light. Okay, good. Same thing again. Paddle, light, paddle, and the light. Paddle, light. Look at the paddle and to the light. Good. Let's pop this here. Okay, good. Eyesight. Fantastic. No issues with the eyes. Let's do the trigeminal nerve. Use the tongue depressor for this one. Okay, so I have a wooden stick here, otherwise known as a tongue depressor. I also have a metal tuning fork here. What I'm going to do is ask you to close your eyes, and I'm going to press at various different points all over your face. And obviously the wood is room temperature and the metal will feel colder. So I just want you to tell me if it's the hot, we'll call this hot, or cold. Okay, this is your sensory perception of temperature, obviously. Ready? Okay, eyes closed. Is this hot or cold? 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 Good. A similar test. I'm gonna retract my pen so it's sharper than this end but not sharp. So I'm gonna press at various points over your face with the blunt side or the sharp side. I just need you to tell me if it's sharp or blunt, okay? This is testing your touch perception. Ready? And eyes closed. Sharp or blunt? 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 Very good. I must say, so far so good. Okay. Just going to press at various points over your face. I want you to tell me if you feel it the same on both sides, okay? Does this feel the same as this? How about this or this? And this or this? This or this? Feel the same? Okay. Does this feel the same as this? Does this feel the same as this? And lastly, does this feel the same as this? Good. Well done. You are doing fantastic, very good. The next thing I'm going to do is I'm just going to touch areas of your face and check your facial muscles. So for this, I need to change gloves, okay? Alright, so I'm just going to be checking over your face and scalp, okay? Okay, just going to lightly press over some areas. Pop your head down. Okay. Any tenderness here? What about over here? Okay. And when I press here, any tenderness? Okay, here. Okay, so when you experience these headaches, what would you say is the sort of concentrated source of the pain? Is it the center of your head? Is it sort of towards the temple region? Is it at the back or top? Okay, so you'd say it's kind of along here and behind your eyes almost, yeah. That makes sense. Almost sounds like a tension headache. And is it worse in the mornings or later at night? What about during the day? Okay. And your job, is it particularly demanding? Alright, okay. So you work long hours, yeah, it's a pretty normal thing to see, to be honest. Okay. Okay, just close your eyes for me. Just gonna press on the lids. Press here on the lid. Just gonna press on this lid. And this region here. Okay. Alright. If you could scrunch your eyes together, I'm gonna gently try and pry them open. Just don't allow me to. Resist, 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 resist. Good. Resist, resist, resist. Good, okay. Now if you could open them wide and don't let me shut them. Okay. If you could just scrunch your nose up. Okay. And now if you could clench your jaw. Okay, I'm just going to feel around here. If you could take a large gulp. Once more. Okay. Just open your mouth and say, "Ah." And again, "Ah." Okay. Check here. If you could suck in your cheeks. Now blow them out. Okay, now if you could turn your head this way, I'm gonna push that way. Just like you to resist if you could. So turn your head. And now resist, 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 resist. Okay, and now this way. Resist. Good. Like you just shrug your shoulders like this and don't let me push them back down, okay? Alright. Okay, good. I'd like you to push your head forward like this. I'm just gonna lightly press on your forehead and try and push you back. I'd like you to again resist, okay? Okay, resist. Okay. Now I'm going to put my hand behind the back of your head. I'll let you to push your head back like this and don't let me push it forwards, okay? Resist. Good, okay. Raise your eyebrows. Frown. Okay. If you could raise one arm up to the side and don't let me push it back down, okay? Resist. And over this side, raise this arm out. Don't let me push it back down. Okay. If you could just get your hands like this and split your fingers. I'm going to push them from the outside. Again, resist. I'm sure you're understanding the theme here. Okay, now I'm going to try and push them out. I'd like you to keep them nice and taut together. Okay. Now I'd like you to raise your arms out in front of you and don't let me push them down, okay? Okay, good. Any tenderness at the back of your neck? Okay, and in the lower back region and just behind your shoulders. Any pain? Okay. If you get your arm like this, I'd like you to, keeping this bit completely straight, only move from your shoulder, sorry, not your shoulder, your elbow, to your fingers. I'd just like you to rotate it back like that, okay? I am going to push against it lightly and I want you to resist, okay? Okay, good. Same again, shoulder to elbow completely straight and then push backwards. Okay, good. Alrighty, that seems to be fine muscle. Let's try reflex. Just gonna very gently knock on a couple of points over your body. This is going to trigger a little reaction, call this a reflex. This one behind your ear, so I'm going to start with this one. And this one. Good. And now, this one just back here. Yep. And there. Good. And now I'm just going to do the one on your elbow. Don't worry, I won't do it hard. Good. Over here. Good. The most famous one that everybody knows, the knees. Ready? Good. Good. And again. Good. There's actually one at the back of your legs, behind your knees, that not a lot of people, not as many people know about. Ready? Perfect. Perfect. Okay, now just sitting back in the chair, I'm going to hold your foot. I'm just going to knock the back side. Ready? Good. Over here. Good. And the front. And the front. Good. Pull this down. Okay. So, as far as the headaches are concerned, I'm not seeing anything in the cognitive areas that would lead me to believe it's a deep-seated issue, something we should be worried about. It's not an early indication of dementia or anything particularly serious so far. I mean, highly unlikely. I think possibly exploring your work life and your sleeping hygiene is really the key to solving this issue. Now, it's not guaranteed that that's the problem. There could be something else. It could be stress triggered by some kind of event. I don't know how your social, personal, love life is, but any of these things can cause undue stress or extra stress, and the body's reaction to stress can be very visceral. It can manifest as headaches, nausea, tiredness. Even if we're not stressed at the exact moment it's happening, these things accumulate. There's a snowball effect, if you like, and they can add up to general sort of under the weatherness, a general lack of functionality that would usually be there. So this is not me saying that I think you're depressed or need to see a psychiatrist. It's simply saying if we look at your sleep regimen, your work-home balance, possibly assess if there's anything there that could be rebalanced to maybe make it a little bit more a little bit less stressful for you. Obviously, if there is any personal issues kind of causing this excess stress, it's not quite as simple as me just prescribing a pill for that. That's something that there is obviously help for, but it's a little more complicated. In terms of the insomnia, I think I'm going to give you some light sleeping pills. However, I give these with a warning not to drink and obviously alcohol and consume these, and also please try and use these as and when you've tried to sleep already. So it's best not to become dependent on them, otherwise when you stop taking them you may struggle to sleep. So it's just basic Nitol. You can get this over the counter, but these are slightly stronger. One a night if you feel you're really struggling to sleep. I would say after you've had the Nitol, it's best to immediately try and get to sleep, okay? So don't go on your phone or watch a film or a game or something that's going to engage your brain. You can watch, sort of passive things like, I don't know, sort of hypnosis or sleep-inducing things like ASMR or sleep sounds or rain sounds or things that actually assist in sleep. But try to make sure that the lights are dimmed. If you are going to go on your phone, turn the brightness all the way down, close your eyes and make sure that you try and sleep immediately after taking, because if you don't, it can actually have the opposite effect, okay? It can increase insomnia, which is not what we want. So I'll give you a prescription for that. I'm going to give you some anti-nausea medication. Again, try not to use it if you can. This is really for the most severe / extreme scenarios. Okay. How about we schedule a meeting, another checkup in 3 weeks? Okay. Yep. And we'll just have a look at how you've been getting on. We'll reassess some of your cranial nerve functions and cognitive functions, and we'll see if there isn't an improvement, okay? If it persists, if it's becoming chronic, then we can refer you to a specialist, okay? But as your GP, I think this is a good starting step, a good first sort of measure to see if we can't improve things. Okay, well, we'll call that the 3 weeks would be the 28th. Would you be free at 2 PM on the 28th? Okay. Yep. Good. All booked in. Fantastic. Well, sure, we'll get to the bottom of this. Thank you very much for coming in today, and I will see you in a few weeks. Okay. Best of luck to you.